Hi everyone, my name is Megan Anslone, and my rebuttal will go against Gage Jarvis's argument that the World Health Organization has been an effective IGO to address COVID and other global diseases. I think Gage did a great job and had a strong argument, but there was some points that I wanted to discuss. I think his main argument, from what I gathered, was that the World Health Organization doesn't have any enforcement power, so they can only really rely on diplomatic communication. I would argue that they were pretty poor communicators and they weren't that efficient in spreading the word about COVID when I think that they did have a fair amount of evidence. One reason that I really one fault in the World Health Organization that I think impedes them from doing their best job at communicating is that they're really slow to criticize governments because they rely on those donations from the countries that are members of the World Health Organization. They're severely underfunded, and that is maybe something to address in the future. But yeah, so how could they be efficient communicators if they kind of have to tiptoe around the truth and kind of be careful with their words and are afraid if they claim something, then they might lose their donation from a very, very rich country like China. One example of the World Health Organization having a huge mistake and jumping the gun on it was they tweeted on January 14th, 2020, that preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus identified in Wuhan, China. Which is crazy because actually a day before that, there was a case in Thailand from a woman who traveled to Thailand from Wuhan. And she denied ever going near any seafood fish markets or anything like that. So I think that kind of points more towards the human-to-human transmission argument. And before the World Health Organization was kind of caught up with what was really going on, Hong Kong and Taiwan were actually pretty successful early on more successful in containing COVID because they did acknowledge the fact that China has had a history with covering up epidemics. One example of them doing that in the past was with SARS in 2003. And back then, the World Health Organization even openly criticized China for not being transparent about it. So Hong Kong and Taiwan actually imposed travel restrictions and began implementing masks and handing them out and stuff because they were very skeptical to take China's word for it. And actually, a month before the World Health Organization tweeted that tweet about it not being human-to-human transmission, health authorities from Taiwan actually sent their own medical teams to Wuhan in December 2019, and they confirmed human-to-human transmission. And they even told the World Health Organization, but instead, the World Health Organization just took China's word for it. So what I don't understand is why, even if they didn't have conclusive evidence that it was human-to-human transition, the World Health Organization didn't have their own tangible evidence for this, why would they just take the word of China when cases were continuing to spread and then Taiwan and Hong Kong were already saying that it was human-to-human transmission? I think that they should have been more on the safer side and more cautious rather than just declaring that it wasn't human-human transmission. I think it would have saved a lot of lives. With that being said, the World Health Organization actually waited till mid-March 2020 to declare it a pandemic, although about 114 countries had already reported cases and 4,000 known deaths were reported. So January 2020, mid-January, they went from no human-to-human transmission, and then mid-March they go to it is a pandemic. So they were really just kind of dragging their feet, even though other countries were kind of like, we need to take this seriously. I mean, and even at that point, there was evidence that countries who were starting to wear masks were doing much better than countries that weren't in February 2020. So, yeah, I think what the best thing that they could have done, even though that they didn't have their evidence, was just say, hey, we should apply some precautionary principles as the cases continue to rise until we can really nail what is going on. Thank you.